Namaste viewers, welcome to another session of live interaction from Apollo Specialty Hospitals, Vanagaram. Cosmetic breast surgery is done to change your appearance. For some, it may mean redesigning the body's contour and shape. For many, it means reshaping their confidence and life. Our consultant in focus today is Dr. A.P. Selvam, who has completed his medical education and master's in the Madurai Medical College. He received training in cosmetic breast surgery from the Mauritius Health Center in the United Kingdom. He has over 25 years of experience in the field of surgery and has helped hundreds of women and men to regain their self-confidence. Namaste, Doctor. Doctor, what is the need for a separate specialty for cosmetic breast surgery?
Now, cosmetic breast surgery is a unique subspecialty of plastic surgery. The need for that is our change in lifestyle, our change in dietary habits, obesity, and few unknown reasons. Most of the people in adolescents, girls, they get relatively large size breasts, which is very much bothersome for them. That is the main reason for this specialty. That is large breasts or macromesia, for which they approach us for their correction. The important message is now the treatment for that is available, and it is affordable, and it is safe.
Doctor, what are the procedures performed under this specialty?
As I said earlier, breast reduction for large size breast, then breast augmentation for smaller breast, breast reconstruction after breast cancer surgeries, male breast reduction, gynecomastia correction, and scarless or invisible scar surgeries for breast tumors and nipple surgeries, and breast lift surgeries. These are all the main surgeries being undertaken under cosmetic breast surgeries.
Can you elaborate more on the augmentation and reduction surgeries, Doctor?
Yeah, breast augmentation, the need for that is obvious. Client who wants to have a larger breast. Reason being, that person's breast may be smaller than what they want, or by any other means breast might have been removed for some other reasons, or they may have a asymmetric breast. One's breast may be smaller than the other. That is the reason they come for breast augmentation. We have two techniques for breast augmentation. One is correction with implants, artificially available implants, either it's a saline implant or silicone implant. The technique is fat injection, drawing the fat from the person's own other parts like buttock, abdomen, and we prepare that fat, then we inject. It's called fat injection technique. These are the two techniques we do breast augmentation.
Doctor, what is the appropriate age for the surgery?
Any age after the person gives consent, that is above 18 years, they can give the consent for the surgery. So after that, anytime the client is physically fit, emotionally fit, and psychologically fit, we can go ahead for the procedure of breast augmentation.
That's a question. Should I wait until I'm done having children to have an augmentation surgery?
No need to wait till the person gets children. It is up to their wish. Even at the age of 18, they want to go for breast augmentation, yeah, they can go for it.
Will augmentation work for me if I feel my breast is sagging?
Definitely. There is one technique called breast lift surgery with augmentation. That person's, because of a few factors after lactations, the skin loses its elasticity and the breast starts to sag, and there is a feeling of emptiness inside the breast where we have to increase the volume of the breast along with the reduction in the size of the skin, definitely breast augmentation will help for sagging breast in few conditions.
Now, can you elaborate more on breast lift surgery?
Yeah, breast lift surgery, which is different from breast augmentation or reduction, which we don't change the volume of the breast, uh, where we rearrange the breast tissue inside the skin, and thereby we improve the projection of the breast, in which we excise the excess skin. And some situation, as I said earlier, if there is volume deficiency, then we do uh, increase the volume by implants. Thereby, we increase the projection of the breast, which is mostly done at the age of 25 to 35. After marriage, childbearing age, uh, client expects to have a better appearance of a breast because of the reason our lifestyle and our costumes. They want better projection, where the breast lift definitely helps.
Doctor, what are the precautions taken before any kind of a breast surgery?
Precautions, what we do is we identify the correct client for cosmetic breast surgery. How do we identify the correct client? We follow a protocol where first the client comes and approaches us for help. Uh, During the first visit, what I do is I assess the person. What is the need of the client? Whether it's a male or female, what is that person's need? After hearing that, we assess the physical fitness of the person. Second, emotional fitness of the person, then psychological fitness of the person. We consider that, then we tell them what are the available options for a person who requests for breast lift. We tell them these are all things available. For augmentation, is that I will explain these are the procedures available. Then I will give that person another appointment, say after 1 week or 10 days. I used to tell them to go on online to gain whatever is available. Now it is easy for us about any surgery. So many materials are available online. We encourage them to go for it. So during the next appointment, they definitely they'll come with queries about whatever we have explained to them. Then I'll, whatever doubts they have, I'll explain. Then I give another appointment, say after 4 days, let them come with the decision. At that time, we decide. So what I mean to say is the selection of client is very, very important for me. I should get the correct client who is physically fit, emotionally, and psychologically fit. After that three appointments, we tell mainly one about the precautions, like for every procedure there is a downtime. Downtime means if we do surgery, the effect of the surgery may not be visible within a particular time. That time is called downtime. For example, I said breast augmentation. Breast augmentation can be done by along with breast implants, saline or silicone implants. If I place an implant immediately after surgery, that is immediate post-operatively, it is visible. At the same time, if I go for fat filling, as I said, I draw fat from other part of the body. If I feel that, that fat has to grow. So it will take time. It's called downtime. So, and second part is financial part of it. Yeah, any cosmetic surgery, that person should not have financial constraint. What I mean to say is that person may need another small touch-up procedure for which they should be financially prepared for that. Next, they should know all the doubts about the procedure. For example, many times they ask, doctor, will I have a scar? Yeah, definitely. The scar will be there, but it may not be visible. So such things, whatever queries, they should ask even before they decide on uh, surgery.
Doctor, there's a question. How does one choose their new size?
New size now options are available. Implant sizes are available. Uh, it is available in the market. But what we do is uh, we have measurements for that person. We measure the chest size and height of the person. We have measurements from the extent of the pectoral region. A person who is having a very narrow chest cannot have an implant of 450 cc or 500 cc. So even though they expect, there are limitations depending on their uh, body measurements.
Doctor, we have a question from Parag Tukaria. What is the cost of breast cosmetic surgery, right side, as it was removed due to cancer at cancer in Chennai?
Yeah. I don't understand the question. Size, what is the
What is the cost of a breast cosmetic surgery for one
cost?
side? One side, right side, it was removed due to cancer.
Cost, cost factor, I would say, it's not very easy to say this much, and it differs person to person, and we should see the person. Is there any comorbidities of that person? Because without any comorbidities, surgery will be straightforward. You may not need intensive care attention, or you may not need um, intensive care services. So it cost differs. So exact cost, it's very difficult to say, but anyway, without any comorbidity, without implants, it may come around a lakh of rupees.
Doctor, how do you choose your clients or assess the suitability of a patient for cosmetic breast surgery?
It's an important question. As I said earlier, we are very much uh, selective in choosing our clients. So many clients approach, as I said, once they reach us, they may ask, will there be any scar? They come to us without sometimes cosmetic knowledge. So we first educate them. We talk about positives as well as uh, what do they think negative. That is, some people they say scar, and some people may not accept the downtime. And another important point which I suggest my clients is they have to come on their own for cosmetic surgery decisions. They should not attempt to do some surgery to satisfy other person, or for to satisfy your spouse or satisfy your partner. You should not go for any cosmetic procedure, in fact any procedure, because that person's taste may change after some time. So that is they should not attempt for that. Then, as I said, financial, and I usually I uh, avoid people those who smoke. Smoking tobacco is detrimental. It causes delay in wound healing. So for most of the time, I avoid cosmetic breast surgeries those who smoke.
Doctor, could you talk more about breast liposuction?
Breast liposuction alone method to reduce the size of the breast. I rarely it is being done, especially for young girls, unmarried girls, those who don't want to have a scar. By this technique, we can reduce the size of the breast little bit. Reason being, breast has two important tissues. One is fat, another one is breast tissue. Breast tissue meant for lactation at the time of childbirth. Uh, Fat content can be sucked out with the tube, we call it cannula. That can be sucked out, fat can be sucked out, by which we can reduce the size of the breast a little bit. Not a huge reduction is not possible. Mainly we do for unmarried girls, those are very much worried, especially if they have symptoms. Other than cosmetic reasons, huge breast can cause severe neck pain, severe shoulder pain. At that time, we are helpless other than doing liposuction because they don't want to undergo a major breast surgery with the scar. So we go for liposuction. Thereby, we reduce the fat as much as possible, which may be helpful for that client.
Doctor, what are scarless breast surgeries or nipple surgeries?
Yeah. The scarless breast surgeries are invisible breast surgeries by which any uh, if any part of the breast, upper part, inner part, lower outer, lower inner quadrant, anywhere, if there is uh, a tumor or growth, we call it breast mouse, which is a very common problem in girls reproductive age group. They have that can be removed, invisible scar. Any part of the breast we can remove through the invisible scar. It means that uh, unless the other than the client, no one can easily identify the scar. It's called a scarless procedure, especially a scar incision which lies along the junction of the dark circle and the skin, which will not be visible at all. And we can correct the nipple size, reduce the nipple size. That also will not have any scar.
Doctor, what are the most common benefits of a breast reduction surgery?
Benefits, uh, if I had selected a correct client for cosmetic reasons, actually the client will be very happy to have a better looking breast with good projection and the size which the client wanted. Then, if it had been done for symptomatic improvement, the client will be very much happy to have a smaller breast which relieves the neck pain and shoulder pain and uh, unwanted appearance and getting notified in a crowd. So definitely it will be very much helpful for the client.
Doctor, we have a list of post-surgical questions. Will my nipple sensation or feeling change after a surgery?
Immediately after surgery, there may be a little reduction in the size of the reduction in the sensation of the nipple, which will definitely improve in due course of time.
How long until I can exercise?
Exercise, client can do a small routine. It can be done after started within 4 weeks. Regular exercises can be started after 6 weeks.
How much pain can I expect?
Most of the time, the pain is tolerable. We give medicine for that, and after 24 hours, I don't expect my client to have pain. It will be there will not be much pain, and they can do their routine work. They can do their kitchen work. Everything they can do.
Can I breastfeed after augmentation?
After augmentation, depends upon the remaining breast. Uh, if that remaining breast tissue works, yeah, that I have seen clients, those who are feeding after breast augmentation surgery.
Doctor, what should I do to achieve the best results from my surgery?
First, your expectation should be reasonable, practical. That is the main point. The cosmetic surgery as such, if you look at it, the client doesn't have any disease, doesn't have any ailment. So in which they think that by improving their appearance, they can feel better. So by doing or manipulating the body, we correct the brain. So if we had a client who has got practical expectation, naturally the client will be very much happy. And the uh, their own physical conditions like the wound healing, if they have not have any other comorbidities, like some people may have arthritis or connective tissue disorder, this all that and all we decide even screen before the surgery. So if I had taken the correct client, naturally the client will be very happy after the procedure.
Doctor, what is gynecomastia?
Gynecomastia is enlargement of male breast. Enlargement, whether a single side or both side. If it is larger than the normal, we call it as gynecomastia. Reasons for that, as I said, our change in lifestyle, our dietary habits, we take a lot of fat. Uh, Obesity is the main cause for large breast for men. And of course, there are other causes, secondary causes, hormonal changes. It may be due to aging, old age. After 50s, after 60s, people may have little larger breasts. Few medicines can cause increase in size of the breast. So it is multifactorial. Maybe primary, we call it without any reason, large breast. And secondary, it is because of some hormonal reasons they may have a large breast.
Can you guide us through the process undergone by your clients?
Especially gynecomastia, how do I do gynecomastia surgery? As I said, I select first whether the breast sizes increase because of primary reasons or any other secondary reason. We do investigate, and there is a physiological reasons for increased size of breast around the age of 13 to 15. It's called pubertal mastitis. So if we identify that, we just reassure them and we tell them it will become all right once the mastitis is over. Then we do investigations, hormonal assays. We exclude the secondary causes, means that because of some other reasons it is enlarged. We do correct treatment for hormonal correction. Sometimes some tumors may cause gynecomastia, for which the treatment is different. If all other causes have been ruled out and we come to know that the breast enlargement is primary, otherwise it is idiopathy we call, then we plan for surgery. Gynecomastia surgery is, as I said, is one of the very satisfying surgery for the client if it is done in the proper way. How do I do gynecomastia surgery? Mostly liposuction. As I said, liposuction means with the cannula we suck out the fat. After that, I insist my clients to go for compression garments, which is mandatory for minimum 6 weeks. If my client doesn't oblige to have the compression garment, I don't do surgery for them, because what liposuction I do is only 30 to 40% of the treatment. All other things will be taken care of the compression garment, that is remodeling of the remaining fat in the breast.
What is the long-term outcome for most people who have had breast reduction?
If the client is well informed and the client doesn't gain much weight or doesn't take more fat, then the breast reduction surgery results are stable 100%. I don't expect any change in that unless that person gains a normal weight.
Look, what are the risks involved in a breast reduction surgery?
There is no risk involved in the breast reduction surgery, other than just like the risk involved in other common surgeries. I don't see any additional risk in breast reduction surgery.
How do I prepare for a surgery?
Preparation for surgery, first your mindset. Mindset, you should, as I said, no, you should come out on your own to decide for the procedure. You should want it, not for other person's compulsion. Then then financially, as I said, you should be ready for that. Then the doctor will decide, will explain what are all the possibilities and the outcome. You should be very frank and you should be open to tell all your um, comorbid conditions, all that. If everything is fine, you will have very good result and you'll be very happy.
Doctor, we have discussed in length. In what way is this specialty unique from plastic surgery?
Yeah, that's a good question. Uh, Cosmetic breast surgery is being done by plastic surgeons. In what way it is special? It is special in many ways. Uh, Starting from my clients. My clients are unique. Their mindset is unique. Their demands are unique. In the same way, how do we treat them is also in a unique way. We keep them, our special clients, we uh, we give them special appointments and we keep their identity and we give we don't keep them to wait and we support them by our paramedical staff. They are in contact with us at all the time. All my clients will have my phone number. They can call me at any time, and we understand their needs. So we keep them and we treat them as our special clients.
Doctor, will I have a dressing on after breast augmentation surgery or a bra, and when can I wear an underwire?
Yeah, immediately after surgery, the client will have dressing. I will change the dressing after 48 hours. First dressing change. After that, also they have a minimal dressing. Over that, they can wear their inner wears. Will not be disturbing. They can, if the client is well informed and is well motivated, they can go work even after 7 hours. There will not be any problem. They can do their routine work other than hard exercises. That cannot be, that we don't advise because there is a possibility of disturbing of suture line, which we allow after 6 weeks.
Doctor, other than cosmetic breast surgical advice, as a surgeon and plastic surgeon, what is the special message you want to convey to the viewers?
For my viewers, as a surgeon, basically I'm a surgeon, then I'm a plastic surgeon. I got training in cosmetic breast surgery. As a surgeon, my message is there is definite increase in number of breast cancers in female. Breast cancers are the number one killing cancer disease in India. So I suggest all my female clients to do self breast examination, which is very mandatory. After the age of 30, all females should know about self breast examination and they should do self breast examination, which will be very much helpful for them to detect early cancers. If we go online, if you type self breast examination, lot of material are there, even videos are available. You can go through. If you don't know about it, you can very anytime you contact our hospital, our coordinators are there, paramedical staff are there to help you. So after the age of 30, every female should know about self breast examination to identify breast cancers. That is one. As a plastic surgeon, plastic surgeons are wound care surgeons. We are the specialists in wound care. There is one false belief in all people saying that any wound should not be washed. Unless the doctor says the wound should not be washed, it should be washed daily. It should be washed with clean water. Any wound which is washed with clean water will heal faster. So I want to change that everyone's mind that wound has to be washed. While you take bath, you have to wash the wound. It helps in healing in many ways, unless the doctor informed you not to do that. These two messages I want to give to you all. Please follow this.
Thank you very much, Doctor. That is Dr. AP Selvam, our cosmetic breast surgeon. Uh, Please feel free to post your questions. The number below 74016-80248. I repeat, 74016-80248. Thank you very much. Good evening.
Thank you very much.